Let's bring him in. Dr. Joe Congini, Sports Medicine Center, Akron Children's Hospital. Good morning, Dr. Joe. What do you have for us today?
Hey, Ray. Good to talk to you this morning. It's kind of, I have a big study, a little bit complex, but your audience is great and they stick with us. We haven't talked concussion in a while. I know that we go through periods sometimes where we talk about it a fair bit, and especially in 2023 with there being some new guidelines, but there hadn't been anything real big in the concussion world, but a real big study came out in the second half of 2023, and people are still talking about it in sports medicine circles. It was in a big, one of the biggest journals known as the British Journal of Sports Medicine, and it talks about the health risks later in life in athletes that had sport-related concussion. I mean, that's what all the parents and athletes want to know is what's going to happen to me later in life. And you know that for so long we've said, hey, gosh, the only way that we really can look at this is by way of this, you know, the CTE study where when the person passes away, we look to see if there's brain damage, you know, in the brain and stuff like that. And this study, in fact, took a different kind of approach. It looked actually clinically at some of the neurologic effects on athletes. And like I said, we're still trying to digest the results. The way that when you try to get a lot of information at once is you pool a lot of studies. So they pooled studies from 20 years, from 2003 to 2022, a lot of researchers around the world. 10 of these studies were in amateur athletes. 18 of them were in former professional athletes. The former professional athletes were European soccer players and American football players. And they looked at these people versus the general population clinically, not by actually looking at the brain, which, you know, you have to wait till the CTE study until they pass away, but looking at them clinically. And there's some good news here, and there's some news that's a little bit concerning. So see what you think about this. So the clinical findings we were looking for neurologically, memory loss, dementia, ALS, that's what people worry about if they've had concussions. And the conclusion is, number one, on the really good side, there seemed to be no evidence of increased risk of mental health problems or neurologic disorders in the amateur athletes that had concussions versus the general population of aged controls. So looking at normal people that were the same age, people that in the amateur study had concussions, when they looked at them later on neurologically and clinically, there did not seem to be any evidence of increased risk of mental health or neurologic problems. That's really pretty good news. We'll have to follow that because obviously that's only been 10 years now, but we're going to want to look at that over time, but that's a pretty exciting news. But then let's move over to the professional athlete side, Ray. There did seem to be some increased risk of neurologic disorders, dementia, even one, significant increase in ALS, Lou Gehrig's disease, in the professional athlete side. And so that is concerning. It's something we've been suspicious of for a while, but when they looked at the people in the general population of the same age range, people that played professional sports and had multiple sports-related concussions did have some increased risk. Now, one thing that got a lot of criticism, studies always get criticism, Ray, was that they didn't control for other environmental factors like heart disease, drug abuse, alcohol abuse, and those things can affect those neurologic symptoms too in the professional athletes. But the first part in the world that I live in of amateur athletes and younger athletes was really, really encouraging looking 10 years later, and that there was not increased risk of mental health or neurologic issues in those younger athletes.
Well, that is encouraging for sure, but still, I love what you had to say there, Joe, about still a lot of work to be done on this on so many different avenues, right?
So much work to be done in so many different avenues. Yeah. But I do, because I have the history of time, and so do you. You've walked down this path with me. I am somewhat encouraged that I think through the years we've moved in the right direction. I mean, I remember the years in the 90s and early 2000s when we were just getting started with this, and it was pretty pretty concerning. And I think a lot of the things that we've done to try to step in and look at things like prevention and other areas, I think some of them have worked to some extent. But you're absolutely right. We need more studies. We need more research to be done to look at things that can help protect the brain of young people. But overall, this result that we found in this British Journal sports medicine study really is encouraging when it comes to amateur and young athletes.
All right, Joe. Great information as always, my friend. Appreciate you carving some time out for us on Wednesday mornings for over 25 years now here on the morning show. Appreciate the friendship, my friend.
Thanks. Thanks so much, Ray. Talk to you soon.